Hello, everybody. Welcome to the 2020 Washington Wellness Preview. My name is Justin Hahn. I'm the Washington Wellness Program Manager. So I want to give you all a warm welcome. You are our school employees, benefits board employers, benefits administrators, wellness coordinators, and we want to welcome you to the webinar on worksite wellness support and resources that the Washington Wellness Program provides as part of the SEBB benefits package through the Healthcare Authority. So thank you for coming and attending today. So this webinar is the official kickoff to begin learning about all the worksite well-being support and resources that we, as the Washington Wellness Program, have to offer. All right, so we have about 2 hours together today we're going to introduce ourselves. We're going to officially welcome school employers. We're going to talk about worksite wellness resources and support that we provide, collaboration opportunities, and then we'll get into question and answer. So we have about 20 to 30 minutes for question and answer at the end of the webinar. So a little bit about the technical piece to this webinar today. So we're using GoToWebinar, and we have a couple hundred attendees that have registered today. So we're very excited that there's so much interest in worksite well-being. And so as such, we've put all the phone lines on mute. And so you should just be hearing me right now, but we can't hear you. As you progress through the presentation, please use the chat box that's part of this webinar to submit questions, and we will answer them at the end of the webinar. And also, likewise, if you have any technical assistance questions, please submit them through the same chat box, and we will do our best to assist because we're monitoring that box closely. And just as a reminder, we're recording this webinar today, and we will post it to our webpage along with our PowerPoint presentation as well in the next number of days. So let's go with the official introductions on the Washington Wellness side. So as I said before, my name is Justin Hahn. I'm the Washington Wellness Program Manager, and so I work with a really dedicated team of very skilled individuals that provide worksite well-being resources and technical assistance to PEB and SEBB employers. And I would like to introduce
this is Aaron Huff. I'm also on the Washington Wellness team. I work with all of the state agencies, helping the wellness coordinators at those agencies with their worksite wellness program.
I'm Jenny Holcomb. I'm the Washington Wellness Program Coordinator here at Washington Wellness.
Hi, my name is Ron Kim. I support the public employers that are part of our PEB insured group, and I also lead the team communication.
And hello, I am Pam Walker, and I support higher education institutions throughout the state and building and sustaining their worksite wellness programs. And I also lead the training and resource development for all groups, and a little bit later I'll be sharing more about that.
All right, this is Justin again. I also want to introduce Kurt Hannes, who is our strategic account representative at Limeade, who is our vendor that we work with for our Smart Health online health and wellness portal. So you'll be hearing from Kurt a little bit later as well. And then we also have.
Oh, hi. I'm Heidi Helsley, and I'm the main point of contact for you for the main point of contact on the Washington Wellness team for you, the SEBB employers. I joined the team in August, and before that I worked with Washington State Department of Health's WIC nutrition program for 21 years. And I was involved in a variety of areas and roles, including program outreach, health promotion activities, WIC clinic staff and retailer training and monitoring, contracting, communications, and I was our office's management analyst. So I am very excited to bring my experience and my passion to this work by supporting SEBB organizations in creating, building, and sustaining wellness programs for their employees and promoting the free wellness benefits to school employees that come with the SEBB plans. So you may be asking yourself, why am I here? Why me? Well, I invited all SEBB benefit administrators to participate in this webinar in order to learn how Washington Wellness can support your workplace well-being efforts during SEBB open enrollment and in 2020. Also, I'm hoping to identify who I can partner with on employee well-being efforts in your organization, and I'm asking for your help with that. So throughout this webinar, you'll hear the term wellness coordinator, and this is the person or the people in your organization who are able to promote free wellness benefits like Smart Health that are part of the SEBB benefits package, who have interest and are passionate about employee wellness, have a desire to build, grow, and sustain an employee wellness program. So being a wellness coordinator might be someone's part-time role, an individual who wants to let other staff know about the SEBB wellness benefits. And since safety and wellness are often focused on together, this might be a committee or a committee member. So just keep that in mind. And if you know who your organization's wellness coordinator might be, please send them my way. So we have some exciting things to share with you about Washington Wellness and how we can help you. So I'm going to hand this back to Justin.
All right, thank you, Heidi, for your introduction. That's really great. So now you all know who your main point of contact is here at Washington Wellness for the School Employees Benefits Board employers. So I wanted to, you may be asking yourself, so what is Washington Wellness? And so I thought, let's start from the top to give you a quick orientation about how this workplace wellness work fits into the sort of main entities that we're part of and that we support. So starting at the top here, the Healthcare Authority. The Washington State Healthcare Authority is committed to whole person care, integrating physical and behavioral health services for better results and healthier residents. HCA, as Healthcare Authority is known, purchases healthcare for more than 2 million Washington residents through Apple Health, otherwise known as Medicaid, the Public Employees Benefits Board program, and beginning in 2020, as you all know, the School Employees Benefits Board program as well. HCA is the largest healthcare purchaser in the state. So moving down from there, because Washington Wellness is located within Healthcare Authority here in Olympia, Washington, we have the School Employees Benefits Board program. So starting in January 1st, 2020, the SEBB program will administer health insurance and other benefits to all employees in school districts, charter schools, and union-represented employees of educational service districts here in Washington State. The School Employees Benefits Board studies, designs, and approves comprehensive and cost-effective insurance benefit plans for school employees and establishes eligibility criteria for participating in these plans. The SEBB board is separate and independent from the Public Employees Benefits Board program. And just as a side note here, everything we're talking about today fits within those benefits for SEBB. So SEBB's sister program that we've been working to support for many years now is called Public Employees Benefits Board program. So the PEB program purchases and coordinates insurance benefits for eligible public employees and retirees. So PEB offers high quality benefits to more than 300,000 PEB program members. The PEB board is separate and independent from the School Employees Benefits Board program. So finally, our program, Washington Wellness, here supports organizations participating in both the PEB board program as well as the SEBB board program. And when we say organizations, we mean all the, that's a catch-all for the organizations within SEBB or within PEB. So currently, there's approximately about 300,000 members covered under the PEB program, and we anticipate there to be approximately another 300,000 members covered under the SEBB program when benefits start as of January 2020. So we're very excited about that. But this is we're serving a lot of people. Just wanted to communicate that. So starting with SEBB open enrollment, we have a unique opportunity to support workplace wellness for SEBB employees, including a $50 wellness incentive through our online health and wellness portal called Smart Health, and we'll talk more about this later. Okay. So a little bit more about Washington Wellness. As you know, I said that we support both SEBB and PEB organization workplace wellness. So we endeavor to offer easy, engaging, and ready-to-use resources, promoting wellness programs that are included in the benefits package. So how do we do this? So this is a high-level view of really what our goal is, and that's Washington Wellness's goal is to build, grow, and sustain effective worksite wellness programs to maximize individual and organizational health and well-being. And how we do that is through certain strategies. So some of the top ones that we employ are evaluating the data to characterize the population. We develop, implement, and monitor evidence-based, population-focused approaches. So that's like things like smart health that we'll talk about with you later. We develop worksite wellness capacity. So we help you as an employer understand what worksite well-being is and provide tools and suggestions for how to maximize that opportunity for your employees. And we also engage the target population directly. So, if they're on our distribution list, we'll be sending emails, things like that. And then we, also maintain and improve our Washington Wellness operations. So our everything, we take care of, this is another way to say that we take care of ourselves so that we can help take care of you all. So, okay, so now drilling down from that high level, I wanted to next talk about a key phrase and concept that is often used interchangeably with the word or the phrase wellness. And that phrase is well-being. There are many ways to define well-being. You're going to hear us talk about well-being a lot today, as well as in our partnership moving forward. My favorite definition is really what we have here, which is living with purpose and feeling good. So this means that you as an individual know your life's purpose, that can change over time, of course, and you're actively supporting it, and that this makes you feel good. So, for example, my purpose is being the best dad for my 5-year-old who just actually started kindergarten in the Olympia School District, and it makes me feel good to fulfill this role. And I use Smart Health to keep me as healthy and balanced as possible. So again, referring to Smart Health that you'll learn about more later. And so optimal well-being is realizing the potential of your whole being across physical, emotional, financial, and work-life balance. So this isn't just an exercise program and to lose weight or things like that. Those can be great goals to have, but this is much more comprehensive. So with that, I want to hand it over to Ron Kim, who you met earlier, who's going to talk a little bit more about why well-being at work matters.
All right, Justin, thanks so much. This is really important, and we have a ton of research that we can definitely share with you if you're interested, if it's needed. But I'm just going to summarize it for you. And so just starting in the upper left, the idea is this, is that when organizations invest in well-being, whether that's at the work site or the employees directly, that ends up increasing employee engagement. And when employees are more engaged, when they care about, coming to work, when they're excited to be there, it's probably not that surprising, but it ends up improving the overall results, right? You got happier employees, more excited, more engaged, you get better work. And some of the key factors, some of those results are these three right here: better productivity, better employee retention, and a better overall employee experience. Now, some of these buzz terms might be really important for some of you. I don't know how many of you might be involved in human resources, right? Or in a leadership role. It might also be extremely important for those that you serve and you work with. And so we're always here to support you in terms of sharing the value of this work, helping share the business case. And so feel free to connect with us if you need some support in that area. So why work with us? I'm going to do my best to summarize it, but just as that previous slide mentioned, wellness matters, right? And for some people, I get it. The term wellness, it might not be a good fit. So if it's engagement matters, or if it's experience matters, or if it's better results matters, whatever's going to speak to your audience the best, we can definitely utilize that term, right? But for the purposes here, yeah, wellness is important because we spend a ton of time at work, and we should definitely look for ways to take care of ourselves, right? And support our overall well-being, which ends up supporting the organization overall. A second important factor of why you should work with us is the fact that there's no extra cost. Our services are included with your set benefits, and we're here to support you, build and grow and sustain effective wellness programs. That's our goal, that's our job, and that's what we do. So calling us or contacting us, it doesn't add to your bill, okay? So don't worry about that part. And in the end, I mean, just to summarize it, really by working with us, and us doing our best to help you, we feel it's going to be a win-win not only for your organization, but also your staff, right? Also your staff as well. Now, all of you, or as Heidi mentioned, maybe somebody else that you work with, right? You have a very important role in this because we can't do it all ourselves, right? Our contact, direct contact with your employees is pretty limited. So we really rely on you to collaborate with us, to coordinate with us, and then eventually to communicate out to your staff, right? We have very few opportunities to reach out to them directly, and so it's going to be extremely important to get in touch with the right people at your organization, so that way we can get these resources into your hands, and then you can share them with your staff. And so to help you with all of this work, we have a tool called the Smart Health Worksite Wellness Roadmap. And this is a visual of what the roadmap is. And basically, we customize this thinking specifically about the organizations we support. We realize and understand that a lot of you, this isn't your full-time job, right? As a matter of fact, this might be a very small percentage of your work. And so understanding that, we've done our best to kind of capture and highlight the key areas in basically a step-by-step checklist fashion to help you build and grow your program in a very strategic way, and yet we feel like it's approachable and it's doable. Okay, and so each of these steps, you'll definitely have more time to kind of dive in and look at these. Just want to give you an idea that there's definitely a formal plan in place to support this work. To tell you why we feel it's really important to use the roadmap, it's not very different than any other project plan. Some of you might work on projects all the time. Some of you not so often. I think the key thing is that we did our best to make it as easy to use regardless of where you're starting from, right? And by using the roadmap, in the end, it gives us actually an opportunity to recognize your work, because by submitting it, you're actually applying for our annual ZOE award. And so as I mentioned before, I know a lot of you, this might not be your full-time job, and maybe the capacity just isn't there. So if it's a matter of just staying in touch with us, being in our email distribution list, getting a resource and sharing it with your staff, hey, that's great. That's a ton of work right there in and of itself. But for those of you who want to go a step further, this is where the roadmap really helps. It kind of helps really put this into a strategic plan and what they call a results-driven wellness plan. Some of the ideas within the roadmap really focus on some best practice areas, and these are three key ones that I'll point out. One is to find a way to definitely align with your organization goals, right? Let's not make this something on the side. Let's make this weaved into what you do. Part of that will be creating policies. And the great part about it is that we have a ton of examples that you can start with. You don't have to make them all from scratch, right? We're happy to share those with you. And then another great place to start is to think about forming a diverse team. And what we mean about that is, looking at different areas of your organization, getting involvement from a wide range of different sectors. That way, everybody's involved, right? Not just necessarily one group. So what we included here is actually the website address. The web page is called Build a Wellness Program. You'll definitely have a chance to look at it in more detail. We have a lot of resources to support you going through and completing each step. But I just want to highlight a couple areas. We didn't invent this all on our own. This is a summary of best practices from a wide range of wellness thought leaders. We feel it's going to help, again, both new and mature programs, so regardless of where you're starting. And then I did mention that application for our award. One thing I want to emphasize is that it's not an all or nothing application criteria. And what I mean by that, again, is because we know that not everybody has the same sort of budgets, the same sort of leadership support. So you might be surprised when you start working with us what that looks like, right? And how we can kind of customize and tailor for wherever you're at, okay? Now, one of the key resources we have to support your work in building and growing an effective wellness program is called Smart Health. I'm just going to tell you why I feel Smart Health is so worth it and so valuable to not only your staff, but also to your organization. And I think the main thing, again, to emphasize is the fact that this is part of your SEBB benefits package, right? There's no extra cost. And I'll go into more detail about how there's features to help employees, but then there's also features to help your organization as well. But rather than just talk about this all in theory, I think this might be a good time to go into a live demo. Oh, excuse me, no, I'm sorry about that, I jumped the gun. We're gonna share a video, it's really quick, and then we'll go into the demo. And so this video, it's titled Why Smart Health Matters. And let's see if it pops up. You know what? I think there's a little bit of a technical glitch with it, but we have a backup plan just in case. All right, so why Smart Health Matters. We created this just for you, so you can be able to share it with your staff and your leaders. And I'll just let the video speak for itself.
We're an organization of committed public servants. And many times when you're a public servant, you're focusing so much on giving to someone else that what you do last is take care of yourself.
Smart Health is our health and well-being program that helps individuals achieve their health and well-being goals across physical, emotional, financial, and work-life well-being. Well, in the state of Washington, we've been thinking about health and wellness for a long time. It's evolved from filling out a form to a comprehensively focused web portal that's mobile-friendly, that focuses on the whole being.
People like the idea that when they are focusing on their own wellness, there's a place to go where they can find others who are focusing on their wellness in the same way.
It's really intuitive, it's really user-friendly. When I started looking at different ways that I could reach some healthy goals, which was weight loss at the time, I heard about Smart Health, it reset me as a priority. I was able to lose 75 pounds last year. It's completely changed how I interact with my coworkers. I have more self-confidence, I'm more active.
As a leader, it's incredibly important to be transparent in how I prioritize health in my life. Share that, and then talk about how that integrates into my job, and then ask other leaders to share that same story.
We're blessed to have a visionary governor who recognizes the environment, the people, hence the investment in smart health.
Well, we had a great walk with great public employees. We walked around the campus, and we had, I don't know, maybe a couple hundred people out there. I was really impressed. Everybody looks a year younger from what I saw last year.
Straight from the top, the governor himself, really aspiring to be as healthy as possible, really supports the work of Smart Health. My health and well-being goals are to just be better myself, a better human, a better coworker, a better mom, better sister, all around. I've learned that it is beneficial doing the activities and logging, and stuff really does help, me. Having better well-being makes me better at my job. I have a lot more energy. It's nice to be able to have Smart Health to remind me to eat better, to drink more water.
I hope that more people take a part and take advantage of the Smart Health program. Not only is it great for helping me take care of my well-being, but it also has great incentive rewards. I think more people need to get involved with the Smart Health program and see what it has to offer for them.
It's going to take you less time than how much time we spend on social media and these things that don't breathe life into us. It's such a small amount of time to invest in yourself, and that's important. Give it a shot. There's a little bit of something for just about anybody in there. Then you're invested in yourself.
All right, so I'm sorry about the some of the technical glitches. I believe the video was probably a little bit choppy from what I saw. And so sorry about that, but I promise you that when you access the video online...
Connect to your well-being. Honda's well-being program encompasses physical, personal, and financial activities and challenges. It rewards you as you move.
Okay, here we go. My bad, but yeah, the video definitely comes out really smooth and clear. You can access it from the resource page that I'll be sharing more info about in just a minute. But as I promised, rather than, continuing to talk about this in theory, and those were some great stories that you heard about from a variety of folks who have used Smart Health for several years now, I'm going to hand it over to Kurt and let him introduce himself, and he's going to give you a live demo of Smart Health. So give us just a moment as we let him jump in here and kind of show you what it's all about.
Thank you, Ron. I'm sharing my screen. If someone could confirm, maybe someone in the HCA office, that you are seeing the Smart Health homepage as I talk?
Yes, we're seeing it, Kurt. Thank you.
Okay, great. So as Ron said, my name's Kurt Hannes. I work here at Limeade, and we're the company that powers the Smart Health program behind the scenes. I'm really excited to be here to chat with you all a bit more about Smart Health. One thing that I'm not sure if Ron and Justin mentioned right from the get-go, but there is a full demo of a click-by-click walkthrough of some of the functionality in the site and the layout. So I'm not going to recreate that or spend too much time going through click-by-click or laying out all areas of the site. Instead, I was asked to focus more on some of the key aspects that are available now and some of the things that you guys can look forward to in 2020. The first thing I want to acknowledge is that there's a lot of change for the school employees here. New benefits all the way around, new benefit packages, and I know Smart Health is one piece of a lot of new inner working parts for you all. So I want to start by grounding us in a few basics for the Limeade platform. And there's three things I wanted to start with. The first is that the state of Washington has invested in the Smart Health program because they care about its employees. And they want employees to be happy, healthy, feel good, live with purpose, really love what you do, and thrive in life, thrive at work as well as at home. So that's one thing, is that they invested in Limeade and the Smart Health platform because they care about you all. Limeade, we take confidentiality and privacy very seriously. So if you can see it on the screen here, we have some links at the bottom of every single page that link over to our terms of service and our privacy policy. I'll also point out a few places where it is linked as I go through my demo. So that's one thing I wanted to talk about right off the bat, is we never share individuals' activity or confidential information on an individual level. We do share some aggregated de-identified information with the healthcare authority as we talk about trends and some of those things, but it's never individual responses or activity for users. The program here at Limeade, everything we do is rooted in science. Ron alluded to this in some of the slides that he was talking through. I won't go through all the details, but we do have a Limeade Institute here that researches and studies trends in care, employee experience, wellness and well-being, employee engagement, inclusion. Everything that we do here at Limeade, it's all backed in research. There's points of view on everything we do. It's a very thoughtful, intentional program for just about everything that you're going to see within Smart Health. So let's go ahead and dive in. I wanted to first start by showing you all how you get in and get access as a new user to Smart Health. So this is the landing page. And one thing I'll mention before I tap into this Get Started link is that you can see right off the bat, the whole branding and creation of the site was very intentional and thoughtful to be inclusive to school employees. As you all may know, public employees and state agencies also have access to the Smart Health platform. So we wanted to make sure that this really spoke to everybody. So you can see as nitty gritty as the images that we rotate through, banners and language we use in the site, we are trying to be very thoughtful and intentional about making sure this resonates and feels like it belongs for school employees as well as the public employees. So to get in, we're going to go ahead and click on this Get Started button here. Now when we do, it's going to take us to a page where it's going to ask to verify some information just to ensure that the folks that are accessing the site are eligible to it and you are who you say you are. So I'm going to enter in some information for a test user. And as I'm doing this, I will point out some links on the right-hand side here that speak to our privacy policy and some of that information for folks to take a look at as they're getting it as well. Okay, so I've entered in my personal information. I'm going to click Find My Account. As I do, it's saying, welcome. We have now verified that you have access to the program. You are who you say you are. I'm going to be prompted to create a username. And password. And then once again, type in too fast. A checkbox here, and once again, more links to our terms of service and our privacy policy. So I'm going to click Create My Account. As I do, I'm going to receive some notices that talk about how Limeade is providing this on behalf of the SEBB program, and these are some ADA legal notices that users can read through and become familiar with. When they're ready, you can click I read and accept and submit. And then as you do move forward, this takes you to a screen where users can select different things that they want to focus on with their well-being and their wellness. Now, one thing that I think is great about Limeade is that the Smart Health platform is set up to be something where users can participate in what they want to improve on. This is not a program that is being done to users. It's not saying you have to do this or you have to do that. Users can go in and work on different areas of well-being that they wish to. So let's just say this person, we're logging in. I'm someone who I want to make sure that I am addressing my stress. And I want to have high energy at work. And who doesn't want to save a little bit of money? So I'm going to go ahead and select some of these items that I would like to work on. And then I'm going to go ahead and jump into the program. Now this is going to land us on the Smart Health homepage. So what we're first going to see here at the top are these large featured activities. Sometimes I explain these as being sort of billboards or banners, things we really want to draw people's attention to. Most of the time, these are going to be activities that we're trying to rally everybody around and get everybody to view and participate in. And going into this, we knew that school employees across the state had different levels of understanding of wellness or well-being principles, as well as being new to the site. So we have this nice informational tile here that welcomes school employees, where you can click into this and read some information about the program. And then you can see the next one talks about what is wellness and well-being, which Justin did a nice job of queuing up. So you can see there's a handful of these available. I'm not going to click through each one, but this is just what this top area, these featured activities are all about. As we go through the year, different things will rotate through these top banners. So you can expect to see theme activities, statewide activities and competitions, promotions and important initiatives that we're promoting to the different users of Smart Health. The next section down I'm going to talk about is the My Plan section. So this area will populate with different activities that a user has decided to join. So you can see these first three are the exact same ones that I clicked through and said I want to work on as I was getting logged in. I want to spend some time talking about the assessment. You can see it has this required banner activity. This is a required activity for users to participate in to earn their level 1 incentive. I'm going to click into this, and it's going to explain a little bit about our well-being assessment. The assessment is arguably the most important activity on the site. It is really foundational to everything we do here in Limeade. It powers a lot of the user experience and things like recommendations for users, and it's a great opportunity for users to really take stock in what's going well in their life, as well as some areas to improve on. I've been at Limeade for several years now. I take this every year, and it always makes me realize some things and is eye-opening for what's going well in my life at that time, or what are some areas that I need to improve on. Hint, hint, it's sleep. I'm a perpetual bad sleeper, so if I were to go through this, I would get recommendations that say, Kurt, get some rest, get some sleep. As we click into this, it's going to take us to a separate area of the Smart Health platform that once again gives a little bit of information about the well-being assessment. It takes about 15 to 20 minutes, and everything is completely confidential. At the end, it gives you this nice report on the different areas of your life and what's going well, what could improve on. It's available on desktop as well as mobile. And I'm going to walk through just a couple of questions so you guys can see what it's all about. So it's going to walk through different life areas. It's going to start here with reaching potential. So a user is going to go through and click whether they agree, strongly disagree, or neutral for how they feel about different questions it's asking. And as you can see, the site steps you through and progresses along for you. If you decide you change your mind on something, you can always scroll back up and change your answers. And one other item I want to show is that you can go down here and you'll be able to continue on to the next screen. Or if you only had a few minutes and you weren't able to finish it, you can go ahead and click on this Finish Later button, and it will save your progress and bring you back to where you left off with the assessment. I'm going to click Finish Later, and it's going to return us to the home page. There's a few other things I wanted to spend some time on with my demo and with my time here. And the next section is top picks for you. So this area has recommended activities for each individual user. So as you go through and progress through the program and you start joining things or participating in activities or clicking a thumbs up or a thumbs down feedback on activities, the Smart Health platform is going to learn from that. It's going to get smarter, and it's going to recommend activities that you enjoy or want to participate in. So this area right here, these 3 activities, these are recommended picks for this individual user. So if I don't really care too much for this clear your workspace activity, I can go in here and I can click hide for now, and it's going to recommend another activity. If I'm not really into gardening or I don't want to cultivate my green thumb, I can continue to scroll through these until I see something that I do like. Gratitude, that's really important to me. So I'm going to click into this, and the first time you do, there's going to be this disclaimer that explains what these activities are and how you can earn points for them. And then there's going to be a description for the activity. And then if you click on this Get Started button, it's going to go ahead and add it to your plan. If you're ready to track, you can go in and you can track it right now. Otherwise, you can always return back to it, and you can see it landed right here in this My Plan activity, which we talked about before. The next section below this is other things to do. So this area is comprised of different activities that are curated for State of Washington employees. So these are activities that are designed to help users build habits that improve whole person well-being. When we say whole person well-being, we're primarily talking about 4 different life areas: physical well-being, financial well-being, emotional well-being, and work well-being. So as you're looking through here, there are various different activities. Some of them are pretty standard get starting things for a new user, like syncing a device. Yes, the program does sync to things like Fitbit and Apple Health and other devices. We do have an app. You can click here and get a code for the app and some direct links on how to download that. And you can see there's custom things. There's this Walk Across Washington activity. This is just for State of Washington employees. Not everybody sees this that uses Limeade. So there are video activities. There may be surveys you see in here. There's a lot of great stuff, and this is all stuff that was very intentional and thoughtful for State of Washington employees that will land in this section here. Something you can't see now, but you will see in 2020 are going to be tiles that look just like these, but they link to different vendors and partners for the state of Washington. So you may see things like links to the dental provider or the medical provider. And you can click into that, you can learn a little bit about that provider, and then you can even take it a step further and follow links to participate in activities that are custom just for that provider. So let's use Delta Dental as an example. Delta Dental may have a tile that says, endorse your favorite dentist. You can click through there and you can do those different activities that specifically link to that partner, that vendor, and award you points within the Smart Health platform. The last thing I want to talk about is the community feed. And this is something that the state of Washington really does a great job of, is promoting different items in the activity feed. So within this feed, it's going to feel like a social media type platform that is just for state of Washington employees and spouses that are going through and working on their well-being and going through this well-being and wellness journey together. So there will be little things that people are doing to improve their well-being. People may share pictures, stories, just a really great way to create this sense of community, because we know that is so important for people that are on this journey. And people, it's really cool when you get in here and see some of the things that people are sharing for what gives them purpose in life, or what is something they're doing that day to improve their wellness and their well-being. So I would highly encourage you all to check out the community feed as well. And that pretty much puts a bow on the demo that I had planned. So Ron or Justin or anybody else there on the team, if there's anything else you'd like me to touch on, please let me know. Otherwise, this is all that I had planned to share.
No, thanks so much, Kurt. Really appreciate that. And so as we kind of switch things over, I did see kind of a trend coming through in terms of the questions around, can I use Smart Health right now? And so the answer to that is yes, you can. It actually opened up with the start of open enrollment. So you can definitely use Smart Health right now. Well, maybe not like right now. Maybe wait till the webinar is over. But you can definitely log in. You can share this with your staff, and you can help them get started as well. And so I'm hoping everybody can see the PowerPoint again, the live demo slide. If folks can't, just feel free to chat in and let us know that you can't see it. But I think it should be up and going. So thanks so much for that demo, Kurt. I think that's going to really help bring to life some of these details that I'm going to share with you now. Okay, so I mentioned it before, how it helps both employees and the organization. Let's start with the employees. Kurt touched on it a little bit. I'll go into a little more detail. There is a financial incentive included with Smart Health each and every year. There's even something right now during open enrollment. And this incentive is part of the package, right? So you can offer this to your staff even if you don't have a budget. And as Kurt talked about, he talked about these other points, but really this is to support each of us, be our best, right? It's so important. So let's talk about that annual wellness incentive. So right now during open enrollment, your staff, anybody who is enrolled in SEBB benefits, who enrolls in SEBB benefits, has an opportunity to qualify for what we call a $50 wellness incentive. And I'll go into more details about that. So that's just during the 6-week window, right? Starting in January 2020, the program experience will be a little bit different, right? And so at that time, that wellness incentive is actually going to increase to $125. And we'll have more details about this. You can find it on our website. And we'll definitely share the details about how to qualify during that time as well. And both of these are great. This kind of helps get some people's attention. But for me, I think the most valuable reason to use Smart Health are what we call those intrinsic rewards, right? What's most important to you? And that would be, to me, the main reason why you would want to take time, do these activities, build these habits so you can be your best, right? So whatever's most important to you. I know for me, it's definitely my kids, my family, right? That's why I try to do the things I do. That's why I ate an apple this morning. So when I'm out and I'm trying to explain to people, well, what is smart health? This is my summary, and this is, I think, an easy way to share it with people. I tell them that it's kind of like my own free personal assistant. So I'll give you an idea. You know, different points of the year, let's say, you know, I'm curious. I'm interested in trying to be my best. Well, I could spend time researching on the internet. I could go read some books. I could maybe even go sign up for a class, right? Those are all great options. But as an easy alternative, I could instead just simply log into Smart Health and see what it has to offer. And maybe right there within a quick glance, I might find something that looks interesting to me and gives me, you know, a great starting place to see whether or not it's a right fit, right? So it saves me time researching. I get some helpful ideas. I can maybe share and connect with others and get going on my journey, right? So it's just there. It's my free personal assistant. It can support me at any time, anywhere. All right. Now I want to get into how Smart Health helps organizations. I think this is really important in terms of kind of selling what I like to call the value proposition for Smart Health, in case you need some, you know, talking points or reasons why this would be something to emphasize and to promote within your organization. First and foremost, it empowers employees, right? You're showing them that you care. Employees really value benefits. There's a ton of research nowadays that highlights and illustrates the fact that it's not just about the salary anymore, right? I mean, you know, I know for me, working in the public sector, salary is not the main driver. And I'm sure for a lot of you within the school organization facet, that's also the case. And so what else is important to us? What else do we value, right? And so part of it is that experience and feeling cared about and that our work has meaning. Another cool thing that I'm going to share about with you is the fact that you can actually get really easy access to some meaningful data. And with a click of just a few buttons, you can actually get a custom annual report that's going to provide a ton of insight that I feel you just can't get anywhere else. All right, so we're talking about open enrollment. As some people ask, you know, can I use Smart Health right now? Absolutely, you can. So anybody who is benefits eligible actually has access to Smart Health. Okay, that's one thing to highlight. Anyone who's eligible for benefits, whether you enroll or not, you can access Smart Health. So I encourage you to try it yourself and see what it's like. And then, as I mentioned before, for those who actually enroll in SEBB benefits, those are the folks who can qualify for those financial incentives, those wellness incentives. Yes, and that's enroll in SEBB medical, and I want to make sure that's clear. You have to enroll in SEBB medical benefits. Okay. Now, we actually have a ton of resources to help you promote it during open enrollment, and I'll touch on that in just a moment. And we really need your help supporting your staff. Not so much that you have to know all the answers about how Smart Health works and all the technical components, because there's actually a dedicated customer service team to help you with that. You just need to know where to point people to. So don't worry about being a technical wizard on it. Just remember where to point people to. And then in terms of snagging the resources, it's also just a matter of knowing where to go. So here you go. We have 2 dedicated web pages on our Healthcare Authority website. One is going to be for either yourself or maybe somebody else that you work with that you think would be the best contact for us, where you can get these resources to promote Smart Health, right? And so the URL is there. And then the other one is where, well, not just your fellow colleagues, but also yourself as a Smart Health user, right? That's where you would go to find details such as who is eligible, how do I qualify, and more, right? So 2 very different places. I think I did see some questions come in about, will we have our presentation online? We will be posting this online, so don't worry about furiously writing those notes. You'll be able to refer to this afterwards, okay? And so the resources for open enrollment to help you promote this during this 6-week window, we have a message that's ready to use, right? So maybe you have access to sending emails. That's an easy way to promote it. We have a flyer. And I showed you one video, right? That's Why Smart Health Matters video. We even have one that I think Kurt alluded to that gives you some, a walkthrough of how it works. We call it How Smart Health Works. And so you have access to 2 different videos. The flyer, the front page of it looks like this. And I'll just read it off. This is from one of our users in our annual survey, and they wrote, "My why is to make a positive difference in the lives of as many people as possible." And so this why is kind of important, actually, because it's going to be our theme for 2020. It's called What's Your Why? And so another word for why, you could think of it as purpose. And so it's really, again, just thinking about what's most important to you. And whatever that is, that's why you're going to, start and continue your smart health journey. So here are the details about how to qualify during open enrollment. It's really easy, 3 steps. Kurt actually demoed it for you. You're going to enroll in your SEBB My Account benefits, right? Go to SEBB My Account, you enroll in your benefits. Then you're just going to go to Smart Health and select Get Started, get your account going. And then what we're asking you to do is complete that Smart Health Wellbeing Assessment. And if you do that, then you qualify for that $50 wellness incentive. Now, all these details are available from that member resource page or that staff resource webpage I alluded to. We also have this information within the guide that's called the Initial Open Enrollment Guide. So you don't have to, write these all down. You can find these in a number of places. All right, let me get to these meaningful data and reports. All right, so I don't expect you to see all of what's on this. This is actually only a small portion of our real-time data dashboard, but this is really interesting in terms of what it relays to you. And so I'll just summarize it for you here. And again, I want to emphasize there's no individual data, right? It's all aggregate. It's going to all be kind of summarized for your school district. But it's going to give you a quick snapshot about how many people registered, how many people completed that well-being assessment, how many people qualified for that wellness incentive. It even will drill down and let you know, well, what sort of activities did people join? Which activities did they join but not complete? And those things are really powerful to inform your wellness program to kind of get an idea of, wow, what do people like? And maybe we should promote the ones that they're interested in, right? I mean, that's basically what it can do for you. So really powerful there. This, I don't expect you to read each of the lines here. I'll summarize it for you, but this is a small portion of the custom annual report I mentioned. And this table doesn't do it justice, but I'm going to highlight it for you like this, all right? So each year, you can get some really cool metrics on both the productivity dimensions, is what we call it, and well-being dimensions. And so productivity, that deals with things like, am I satisfied with my job? Do I believe in this work? And then with the well-being dimensions that deals more directly with the person, we're talking about things like, how's my energy? How's my stress? And so as you start working with us more and you get more people using Smart Health, this report comes more to life because this is based off of what everybody submits on their well-being assessment. So I know that was a lot of information, but we still have more for you. And I'm going to hand it over to my colleague, Erin, who's going to talk to you about Smart Health for 2020.
Okay, thank you, Ron. So now that you guys have had a chance to see the look and feel of Smart Health, what I want to do is just take a few minutes to share with you some important promotions and events that are happening for 2020. So the first event is our statewide assessment challenge, and this is where you take your well-being assessment when you first log into Smart Health. The WBA is really the foundation component to anything we do. It also has a machine power for learning, and it makes recommendations based on how you answer your questions in the assessment. It also raises awareness to areas in our life where we have strengths, and also helps us understand areas that we might need a little extra help or need a little bit more improvement on. And lastly, with the well-being assessment, we have the ability to kind of track year-over-year improvements that we've made, and can see how you can compare those. When you look at your well-being assessment, you can compare it to other smart health users as well. Okay, so just a few details about when you're going to be able to see this challenge. It's going to start January 3rd, and it's going to run until February 29th. All the school districts will be competing against other school districts in the state. So it'll be kind of everybody versus everybody. And then there's going to be two different ways that you can win. One of them is having the highest well-being assessment completion percentage. And then the other one will be having the highest number of well-being assessment completions. So, all right, so if you're interested in doing this and you're looking for some additional support, good news is that we'll have a launch email that'll be kicking off the event. We'll also have an in-platform custom leaderboard update. So when you log into, when you take your well-being assessment in that tile that you actually do that in, it'll actually have a leaderboard within that tile that you can refer back to a couple different times during the time period that'll get updated. We'll have continuing ongoing promotions and messages that you'll be able to use. And then we'll also have available a toolkit that you'll be able to download on our website. And within that toolkit, it's going to contain email messages that you'll be able to just put into your Outlook and send those out to your employees within the district. You'll also have different flyers that you'll be able to print out, some posters, and then for those schools that have monitor slides to display different events and things that are happening, we'll have available some promotions about this event that you'll be able to put on those digital slides or the digital monitors as well. Okay, so that's a little bit about the well-being assessment challenge that we're going to have. And then we're actually going to have two other events that are going to happen later on in the year, and we'll follow up with you more on the details of those. But just to give you a quick preview, one of them is going to be a leader walks, where essentially you get together with employees in your district, and hopefully you're the principal or your superintendent, and you have an organized walk. We've done this something very similar to this for state employees with the governor's walk, where we have state agencies and employees meet at the Capitol campus and go for a walk with the governor. And then also later on in the year, we're going to have a statewide charitable giving campaign, and this essentially is going to be where you'll be able to donate or participate in some type of a charity event. And the details of these we'll follow up with you on those. Okay, so next benefit that we have that'll be available for SEBB employees, I want to take just a little bit of time to talk to you about our diabetes prevention program, which is powered by OMADA. And diabetes, as many of you may know, is a complex group of diseases all related to high blood sugar. In Washington, diabetes is the 7th leading cause of death, and thankfully, we have a program to help reduce the incidence of diabetes in our state. The Diabetes Prevention Program is an online behavioral program designed to help at-risk individuals combat obesity-related chronic diseases. Employees in the program make modest health changes that lead to weight loss and reduce the risk of type 2 diabetes. So what plans are actually going to have this program covered? So for those SEBB employees who are covered under the region's medical plan, you are covered by OMADA. For those who are part of the Kaiser medical plan, you also have the availability of using OMADA. And then for those who have Primera as their medical plan, it's going to be an in-person diabetes prevention program. So unfortunately, it's not virtual at this time, but it's based on the same curriculum that the OMADA program uses as well. Okay, so why are we going to do DPP? Well, 1 in 3 U.S. adults have prediabetes, and just over 125,000 hospitalizations occur each year. In addition, here in Washington State, the cost of diabetes is $6.7 billion. Its proven success, the OMADA program, is based on the same curriculum as the National Diabetes Prevention Program and is recognized by CDC to reduce the risk of prediabetes. And then lastly, we know that if we can reduce our risk of acquiring chronic diseases, we can also lead healthier and improved lives. Okay, so how do you promote this program to your employees? So similar to the Smart Health program, we do have a video that'll be available that we're actually going to view just here shortly. We will have messages, email messages that will be ready for you to send out to employees in your school district. And then lastly, we'll have flyers and other promotional materials that you can use as well to promote the program. Okay, so what are some of the successes that we've seen so far with the program? Well, we know so far that we've had 10,161 pounds have been lost within the OMADA program. And then of those people who have lost those pounds, there's been just a little over 1,516 enrollees in the program. Okay, so now I'd like to just switch over and we'll watch this short video on the diabetes prevention program.
Introducing OMADA, a digital health program that uses a combination of proven behavioral science and rich data science to build healthy habits that stick. Whether you're living with one of these chronic conditions or hoping to reduce your risk, OMADA is designed to help. Once you're on board, we send you a wireless scale that's already linked to your account. All you have to do is this. Based on input you give us, we match you with a professional health coach who's empowered with data to deliver feedback, encouragement, and personalized guidance that fits within your day. We also match you with a community of other participants a lot like you for added support, accountability, and sometimes a little healthy competition. You kick off the program by tracking your food and activity in simple, sensible ways. Meanwhile, we take weekly interactive lessons that teach you how to make little changes that can make a big difference, beginning with 4 key areas that impact your health. And you gain skills that help you replace current habits with healthy ones. It's this combination of accountability, support, tools, and insights all working together that makes the OMADA program so powerful. Within a few months, through thousands of data points, paint a clear picture what habits are working best for you and where you need to double down on effort. Then, you can work with your coach to focus on challenges that are most critical for your long-term success. OMADA provides personalized support powered by science to inspire you to transform your health in lots of tiny, totally doable steps. Are you ready to take the first one? OMADA.
Okay. Just a second here.
There's no video.
All right, so now that you've had a little chance to hear about the OMADA program, I'm going to hand it over to my colleague, Pam, who's going to talk to you a little about upcoming trainings for 2020.
Thank you, Erin. So I am excited today to give you a preview and overview of the training for 2020. I'm going to start off talking about a little bit about why and how we bring annual training to the folks that we work with throughout the state. So firstly, we provide training every year for wellness coordinators, wellness committee members, supervisors, managers, and now we're excited to offer it to all of you folks as well that perhaps currently work in some capacity with wellness in your organization, your work environment, or are planning to. So we're excited to include you and our training focus for next year. And our main objective in providing the training is to provide educational opportunities that can really help build your knowledge and skill around worksite wellness programming and the resources that you need to develop programming that is very specific to your needs and interests in your respective organizations that fit well in your culture that will ultimately increase employee well-being. So how do we go about this? Well, we very much try to take a strategic approach. We have various sources of input through assessment and evaluation. For example, we look at past event and training evaluations, as well as our annual Smart Health Wellbeing Assessment Report to help inform, interests, needs, data that supports a certain focus in various health issues and topics. And along with that assessment and evaluation, a very important component of us strategically planning training is collaborating with the wellness coordinators, and for that matter, their wellness committee members, leaders, a very strong focus on a collaborative approach along with the assessment and evaluation, so that we're really being strategic again and developing a training plan for the following year that will really help grow your workplace wellness. So the what, we'll first take a look at the various formats that we will be delivering the training for you. We will offer in-person trainings as well as live and archived webinars. And my respective team members and I, with the groups that we work with, the organizations we work with, throughout the year, we go on what we call on-site visits to help further support and develop your worksite planning and programming. And so we will provide and continue to provide, training, again, based on your needs and interests, certain things that you want to focus on. We can provide that on-site training. And then lastly, we offer an e-learning module. It's titled Wellness Training for Supervisors and Managers. It's on our state learning management system, but the training is also available in alternative formats for those who do not have access to the state learning management system. And as Ron shared earlier, he had a slide that represented visually the 8 roadmap steps. And on the first step, getting leadership support, there's a link to that e-learning training. So you could go back and reference that, when we provide these materials for you. All right, without further ado, these are the topics and what we are planning overall for training in 2020. We will be offering 4 quarterly training presentations. The first quarter will be focused on mental health in the workplace. We have a date, time, and location already. It will be on February 26th from 10 a.m. to noon. It will be a live presentation. You can join at the site. It will be here in Olympia at the Health Care Authority. But in conjunction with that, we offer a live webinar. So folks throughout the state, regardless of where you're located, can join in for that. But again, as I shared with the previous slide, we will do our best to have that provided for you, taped and provided for you and on our website for you to reference at a later date if needed. Our second quarter topic is tobacco cessation. Excuse me, let me back up. The tobacco cessation, it's an ongoing focus and one that we always continually promote the wellness benefits associated with tobacco cessation. The health plans offer various cessation benefits that are based on evidence. They're evidence-based, and they're a wonderful resource for those wishing to quit the tobacco habit. The third quarter will be sleep from the annual Smart Health Wellbeing reports that we receive. The last 3-4 years, sleep has been a self-reported health issue for many state employees, and so we're going to zero in and bring some good information and how we can help in the workplace with sleep issues. And then lastly, the fourth quarter will be diabetes prevention, and I just defer back to Aaron and him emphasizing and underscoring the health issue that this presents, and we continually again promote and provide training and resources for this very important health issue. Okay. So I want to emphasize, though, with all of the trainings that we provide, they come with a packet of resources. And all the resources, as well as the logistical information for the trainings, can be found at the URL is provided here on our Washington Wellness Meetings and Materials page. And so this packet includes a ready-to-use toolkits. And what I mean specifically by that is there will be very step-by-step promotional campaign guidelines for you to implement tied to the respective topic. There will be ready-to-go email messages to employees throughout the campaign, the promotional campaign and focus, promotional posters, flyers. So again, you'll have a ready-to-use toolkit that you can implement to promote that particular focus in your workplace. So I'm going to switch gears a little bit. We're excited. We've been working with Kaiser Permanente to bring together an opportunity for all organizations that we work with throughout the state, and that is the Kaiser Permanente pilot titled Live Healthy, Work Healthy. And this is an evidence-based program that Kaiser offers. It was originally developed at Stanford University. It is a chronic disease self-management focus. They have trained facilitators in the areas listed on the slide in the Olympia, Tacoma, Everett, and Seattle areas. And again, we want to try this out, and we want to really hear from all of you who might be interested in implementing a pilot on site. We're going to be offering 5 pilots altogether. And the program is, again, on site. It's 12 one-hour sessions over 6 weeks. And there is absolutely no cost for Regents UMP, Primera, and Kaiser members. Okay. We've provided a URL here that you can find out a lot more information about this evidence-based program out of Stanford. And we've also provided our Washington Wellness Inbox URL. Again, for those of you that would like more information or interested in possibly implementing a pilot on site in your workplace, please let us know, and we'll follow up with you and go from there as far as what you're thinking about and interested in. Okay. And so the last thing I want to highlight today is the Healthy Worksite Summit. The Healthy Worksite Summit is primarily hosted by the Association of Washington Cities. And this is an annual summit, and we play a participating role, we meaning Washington Wellness. We are a sponsor, a yearly sponsor for the summit. We also hold 2 seats on the planning committee to help plan the conference each year. And we also offer our own session at the summit. That we hope that many of you will attend the summit overall, and also, of course, our Washington Wellness session. So a little bit more information and why to attend. Its first focus is it's a wonderful opportunity to make connections with your peers and network, share ideas, and really leave feeling jazzed and motivated to try different things that you've learned there, and making those connections. It's a really top-notch, high-rated statewide conference on the same level of all the national conferences throughout this United States that offer worksite wellness conferencing. You'll hear as a result from key professionals and experts in the field of worksite wellness, and again, be able to walk away with some tangible ideas and excitement about going back and giving those all a try. And then, of course, all of that will lead to, learning and continuing to build your skills. Okay, a little bit more of the details tied to the summit. It will be at the Linwood Convention Center, and the date for 2020 is March 18th and 19th. There are 1 or 2 day registration options, and those registration options will begin in December. In 2019, there was an early bird cost for the 2-day registration, which was $250. And we'll be sure, of course, as all of our training and events continue to develop and unfold, we'll, send messages and updates and keep you well informed as far as each step you need to take in the process. So, and we were excited because in 2019, over 400 attended, and it consistently is well attended each year in the state. And what's nice is it's local. You don't have to go very far to really, again, get, evidence-based, top speakers in the field right here in Washington on this very important topic of worksite wellness. You can learn more about the Worksite Summit. We provided the URL there. Okay. And we're excited also because each year we are able, through budgeting strategies, offer a number of scholarships. And for 2020, we'll be able to offer you folks, there will be 40 available scholarships. And of course, we're also hoping that many of you have, the resources, the budget to, if needed, to attend the conference. We will send out the detailed information and how we go about, selecting those organizations, specifically the coordinators and whom will receive the scholarships. The scholarship covers the 2-day registration fee. It does not cover other expenses, for example, overnight lodging and some meal coverage. There is generally food available. Generally, there's breakfast items in the morning and a lunch provided. I don't know the details yet in that regard for 2020, though, but that's what's generally been offered in the past. And again, we will be sure to keep sharing the details and the scholarship information as we move forward in 2020. Okay. So I'm going to turn this back to Heidi because she's going to share with you some collaborating opportunities that you can have with Washington Wellness.
Yeah, so this is Heidi. I just wanted to let you know that I'm available to provide all kinds of assistance to help your workplace wellness efforts thrive. So we have workplace wellness support, workplace wellness resources, and advisory work groups. So just to kind of explain that a little bit, so as your main point of contact on the Washington Wellness team, I can provide technical assistance in various ways, through emails, webinars, phone calls, site visits, and etc. As far as the workplace wellness resources, I can connect you, the wellness coordinators, with the available resources that we described today. I'll be sending communication as we have more information and we can stay in touch. I'll be setting up opportunities for us to connect as a larger group by phone or webinar to check in about efforts and share ideas, get your input, and more. So expect to be hearing from me, and of course, feel free to contact me. And I really look forward to collaborating with you. So.
All right, so this is Justin Hahn again. Thank you, Heidi, and thank you, everybody, for all those great presentations. So we're nearing the end of the webinar right now, but please don't go away yet. I just wanted to check in with our team here to, we've talked about a lot of things today. So your head might be spinning a little bit. So I just want to reiterate the fact that to take care of your well-being. So if you need a break, take a break, then come back to this. We are going to be providing a video or a recording of this that Heidi will be following up via email as far as how to access that. We'll also be posting this presentation to our webpage, and where you can click on the, in PDF, I believe, and you can click on the URL links or the emails associated with this presentation. So, so I just want to check in with my teammates here to see if there's any questions that are outstanding right now. I know that we have been answering questions live, and but I'll just check in to see if there's any outstanding questions right now.
Yeah, it looks like we still have time, and there's been some great questions coming in, so thanks so much for paying attention. I mean, I believe we went through and we've answered all of them. Some of them I've done my best to kind of share the answer with all, but we'll probably find a way to kind of share those in more detail afterwards. But some of the trends I think were around, again, is Smart Health available right now? And yes, it is. So definitely get started now. You don't want to miss your window during this open enrollment period. There was a question around the wellness incentive. They said, well, why would I want to do it now if I can qualify for the $125 starting in January? And that's a great question. And actually, you can qualify for both, and that's the reason why. So the $50, the way the wellness incentive works is it typically gets applied the following year in January. Okay, so when you do this during open enrollment, you're going to see that, hit your account in January 2020. And the way people would be able to verify it, this was another question that came in. We actually are going to have a tile within Smart Health, and it's going to be titled, "How do I find my wellness incentive?" And it literally gives each member, each employee, step-by-step directions, and it's tailored to whatever health plan they enroll in. So Smart Health is savvy enough to know, which health plan the member enrolls in, and then it'll give them those customized, steps to follow so they can go and verify it so it hits their account. So whether it's going to either apply to the subscriber's medical deductible. So the $50, for example, will either reduce your medical deductible by $50 in January for 2020, or for those who enroll in a high deductible health plan, it's going to deposit it into your health savings account. There was a great question of whether or not it's a one-time thing or a monthly thing. It is a one-time thing or an annual thing, we'll call it. And so starting in January 2020, for those that qualify for the $125, that again will be applied in January 2021. And so the period to qualify for most folks is going to be from January all the way through the end of November of 2020. And the steps will be different. You're going to have to do more than just complete the well-being assessment, so just a heads up on that. But we'll have all the details there posted on our website, very likely at the start of the new year, right? We don't want to get people confused. We want them just to focus in on open enrollment. There was a lot of questions around whether or not we're going to post this presentation. We'll definitely post the presentation, and I got a feeling that we'll have Heidi send out kind of an email alert letting you know, hey, it's live. And yes, we could email it to you directly, but we'll probably point you to the webpage just so you get familiar with where stuff is at. And hey, if you miss a training that Pam touched on, you can maybe follow up and go look at the resources afterwards. Let's see, this question, is the assessment required for the $50 incentive the same assessment required for the statewide assessment challenge in January? Yeah, this is a good question, and so yes. And so the way it's going to work actually, for those people that kind of, are paying attention right now and complete that well-being assessment during open enrollment and qualify for that $50 wellness incentive, you actually won't have to complete the well-being assessment again in 2020. We're just going to kind of transfer and carry it over, right? To that statewide assessment challenge, your participation will automatically be counted and you'll be helping your, organization kind of rise to the top in that leaderboard ranking. The same thing in terms of qualifying for the assessment itself is worth 800 points. And so starting in 2020, members will need to earn a total of 2,000 points. And within that 2,000 points, you also have to complete that assessment. So you'll have completed a big portion of what you'll need to do to qualify for 2020. So that's another great question. Let's see here.
Ron, let me chime in on this one. We got a question about, does OMATA DPP participation link to Smart Health for employees to earn points? I believe what they're asking is, is there going to be a link to the diabetes prevention program? The points that you get for that count towards the DPP, and the answer to that is no, it does not. Not anyway. Yeah, it's just all self-reported.
Yeah, and so what that means for folks is that there'll be a activity tile that talks about it, and people will be directed to go and take what we call the quiz. It's a 1-minute quiz. And so whether or not you are eligible for the program, you can take the quiz and earn points within Smart Health. But for actually being eligible and completing it, there's nothing that's going to tie back within Smart Health and give you points for it.
Thanks, Ron. So I'll answer the next couple of questions. There's a question about someone's been asked about how to participate without a computer or internet access. And there are, if somebody does not have access to a computer, we do have alternatives that people can utilize, and that's through a partnership, vendor partnership with Limeade, who runs Smart Health. So, and information is actually at the bottom of the Smart Health portal that Ron mentioned earlier, as far as that URL when you actually get on the site. There's you'll read about sort of like the reasonable alternative standards, the RAS, and that's where that's described. And you'll also find there frequently asked questions about Smart Health. That was another question that came in. It was, will there be an FAQ with these questions and answers as they're sent out? And we will send out the questions and the answers, so that will be sort of an FAQ, I suppose. But you just know that there's also an FAQ that is standard and already posted to the Smart Health portal on the bottom bar. Okay, and then all this answers other one question too is about how do we receive the 125 incentive? And so Ron alluded to this, described this a little bit, so I'll just reiterate that for open enrollment this fall, it's about completing the well-being assessment. That qualifies you for the $50 if you are medically enrolled, and so that's a really important thing. So if you have a medical plan, if you don't have a medical plan, you can still utilize Smart Health, but you'll be portal access only is what we call it. So that's $50. The same thing for starting in January. The new year starts again, and as Ron said, there's a special, normally the WBA resets every January, but everybody who's completed the WBA during an open enrollment, that's going to actually roll forward into 2020. And so again, those that have a medical plan, those are the ones that can qualify for the incentive, which will be $125 in 2020. And what they need to do is complete the WBA, which will have already have happened if you did it during open enrollment, which is worth 800 points. And then in addition to that, you earn 1,200 additional points to doing these tiles for a total of 2,000 points. And that gets you to what we call level 2. And then you qualify for that $125. And we do all that on the back end, and we make sure that that 125 gets applied to the health savings account or the medical deductible by in January of 2021 when we're talking about the 125. Okay, so let's see if there's any more questions that have come in. All right, so.
Oh, okay. The question is, what is the ZO8 award? Okay. It looks like, Ron, you attempted to answer that via, okay, all right. Okay, so I just want to quickly say what. All right, so the ZO8 award, I'll give a summary of that. As Ron shared with you earlier in his presentation, the 8-step, the roadmap steps, those steps are considered best practice guidelines in worksite wellness programming. And we, as he also shared, we provide training, education, a lot of resources to, help promote and support your efforts in meeting those steps. And so we receive early in each year, we message out to you folks and encourage everyone to take the online, very user-friendly progress report and for the previous year as far as accomplishments specific to each one of those steps. And then you submit that application as far as your progress. And also, Ron stressed that this isn't an all or nothing expectation. It's very much about you reporting your progress and possibly future plans specific to these 8-step best practice standards. And in doing so, we like to recognize those submissions and extend what we call the ZO8 Award. And I was actually on the team and committee that originally came up with the name, and just a little explanation there. ZO is Greek for live, for life, and 8, that's representing the 8 best practice standards. So again, it's a way for us to give you recognition for your progress and continue to support you in striving to meet or continue to meet the 8 best practice road steps.
All right, thank you, Pam. There's a couple other questions that have come in that I'll answer here. So the question is, there are many married couples in districts who have one spouse decline coverage and enroll under the spouse's plan. It would be nice if they both receive the incentive in those situations. And I wholeheartedly agree that would be nice. And if it were my decision, I would definitely do that. Unfortunately, it's for the subscriber only. So the only way that a couple could both benefit for the 125 incentive, instead of the subscriber being, access to Smart Health and being able to earn that incentive, and then the spouse or state registered domestic partner just having portal only access. The only way for them both to have access to that incentive would be for them both to be subscribers on their own independent plans, which oftentimes I think doesn't make financial sense in a different way. So, but I definitely appreciate the sentiment. And then another question: if someone completes the 2,000 points worth of tiles and then retires, will they receive the 125 on their PED plan? And I'm not sure if the person who submitted this meant to say SEBB plan, but for PEB and for SEBB, actually, the policy is if you need to be eligible in the year that you earn the incentive or that you qualify for the incentive, and to receive the incentive, you still have to be within that a medical plan with PEB or with SEBB. So if someone retired, let's say in February, well, they would receive it in January, and if they use their benefit during that month, then they would benefit from it. Or if they, later on in the year, they would have until that point if when they retire means they're going to be getting off this coverage, they could utilize it up until that time when their coverage ended. And let's see, the next question is there going to be guidance on how to report the wellness incentive on the subscriber's W-2 form? That's a great question. So this wellness incentive, our history with the PED program, is that the wellness incentive is part of the rate. The way that it is applied and the way that it's provided to the subscriber, it is not considered income, and so this is not something that's taxed by way of W-2. So unlike, for instance, if there was a gift card or something like that, that would be a different story. But this is not treated as a gift card, and so there's not tax implications for the individual or for the employer to track. So I'm going to check in with my colleagues and see if there's any more questions that are coming in. All right, so let's see. I'll give it another couple seconds here. So as I'm talking, unless another question comes in, I just want to thank you all for joining us today. It's been our pleasure to introduce ourselves to you, and we can't wait for you to introduce yourselves to us. especially Heidi Helsley, who was our lead on SEBB promotion and SEBB support. And we're here to serve you and to make this transition as easy as possible. And I just want to say I recognize that this is a big change for a lot of folks, but hopefully this is a part of the silver lining for all this change is that you get a robust worksite wellness support and tools and resources. So